Respiratory syncytial virus, or RSV, is a virus that infects the lungs and respiratory tract, causing cold-like symptoms in people of all ages. It is so common that most children have been infected with the virus by the age of 2. That's why doctors like pediatrician Badrinath Kulkarni with Community Health Partners are urging parents to add the latest RSV vaccine to their child's list of immunizations. Respiratory syncytial virus, or RSV, is the leading cause of hospitalization in infants, being 16 times higher in hospitalizations than the flu.
Every year there's about 80,000 to 160,000 hospitalizations for RSV pneumonia for adults above 65, and then up to 10,000 people die with RSV pneumonia every year. Older age groups, especially if you are immunodeficient, you're more likely to have an RSV problem. RSV causes about 529,000 hospital visits in children less than 5 years every year. And there's about 60,000 to 80,000 hospitalizations from RSV in children less than 5. And we have about 300 to 400 children die of RSV every year in this country. So with RSV vaccination, we can reduce that number to close to 0.
The RSV vaccine was approved for use in July of 2023 and is an active immunizing agent used to prevent RSV, working to cause your body to produce its own antibodies against the disease.
This year, Sanofi came up with a vaccine called Beyfortus. So it's not actually a vaccine, it is a monoclonal antibody. It is an injection that is given to the baby after the baby is born.
Also, an RSV vaccine for expectant mothers is available to protect mother and baby during RSV season, which is typically the fall and winter in the United States.
So it should be given between 32 to 36 weeks of pregnancy, and it works for 6 months. So it protects the baby after the baby is born.
Just as having your child vaccinated can protect them from diseases like polio, rabies, and even tuberculosis, the RSV vaccines available can help keep you and your family safe.
We don't want these old diseases to come back. US is an advanced country, so we have universal vaccinations here, and they mandate certain vaccines because the government and the CDC and the doctor community know how effective the vaccines are.
Side effects for the RSV vaccine might include rash and or injection site reactions.
Every medicine and every vaccine comes with a risk-benefit ratio. So we have to see, what are the risks and what are the benefits. Because if you consider only the risk of the vaccine, then you're going to be dealing with the risks of the disease later on in life.
Dr. Kulkarni encourages parents to talk to their child's pediatrician or primary care provider about the vaccine to learn more. That's all for this week's episode of Medwatch Today. Please join us next week for more inspiring stories from inside community. I'm Amberlyn Carroll. Thank you.